The California Community Care Licensing Division's purpose is to serve the most vulnerable people of California by promoting the health, safety, and quality of life. But who regulates these regulators? Recently, Sovereign Health's Rancho, San Diego adolescent facility has been at the center of unnecessary and intense scrutiny. The Rancho, San Diego treatment facility is a sanctuary for children with mental illness and recovering from trauma. On January 10, 2017, during a routine visit to this adolescent facility, the California Community Care Licensing Division violated its own regulations, intimidated the faculty staff, and endangered the lives of its adolescent patients and staff members. 4 individuals came to the facility, 2 were representatives of the state. The other 2 refused to properly identify themselves to staff members. It is a CCLD requirement that all individuals visiting the facility identify themselves.
Sovereign Health helps children with mental illnesses and those recovering from trauma. The facility claims that 2 social workers showed up for an inspection last month, and they brought a man with a gun with them. According to a complaint, that man bullied Sovereign Health staff members, and the social workers refused to tell anyone who he was.
After repeatedly refusing to identify himself or his agency, this stranger openly carried his firearm through the facility in full and plain view of the child residents, with no regard for their past traumas or mental health needs. When asked, the state office refused to answer who this individual was and why this individual felt the need to carry a gun into a children's trauma facility. In regulatory documentation provided to the team members present on this day, the armed man's name nor his associate were included. These falsified documents deliberately omitted the inflammatory presence of an armed man and were only the start of unjustified dissection of the Sovereign Health facility. Sovereign Health filed a complaint with the Department of Social Services about the CCLD's actions that clearly put children in danger and prevented Sovereign Health from tracking visitors to the facility, something that the CCLD mandates. The CCLD then imposed a dragnet audit on patient files, ordering the facility to copy every single file of any adolescent who has been at the facility since its inception, and proceeded to allege unnecessary testing. Sovereign then clarified their testing procedures and paperwork, as well as other recommendations of the CCLD. As you can see, these claims are completely cleared by CCLD. Meanwhile, Sovereign Health's complaint about the January 10th visit has been gathering dust. The Department of Social Services has yet to reach out to Sovereign Health or release any findings for their investigation. Instead, Sovereign became a target of repeated visits by the CCLD after filing their complaint. Sovereign Health is voluntarily accredited by the Joint Commission, a federal body with much tighter regulations than the CCLD. Dr. Tanmoy Sharma has been a leading figure in the push to tighten regulations for more compliance in the behavioral health industry. And he, along with other members of the governing board, had repeatedly cleared federal-level fingerprinting clearance as required by CCLD for adolescent and adult mental health facilities. Sovereign Health's Rancho, San Diego facility has been recognized by the McLean Hospital, a Harvard Medical School affiliate, as an outstanding provider of behavioral health and addiction services for teens. Their 2017 report stated Sovereign Health sees people who are twice as sick compared to 50 other Joint Commission accredited facilities, and their clinical outcomes are 3 times greater than these other facilities. Sovereign Health is a leading example of exemplary care for adolescents and adults with mental health and rehabilitation needs as California continues to deal with the shortage of treatment providers for adolescents. Sovereign Health will not allow unnecessary interference to distract them from their mission to aid adolescent patients in their recovery. For Sovereign Media, I'm Melissa Bohenik.